Bismillah Rahman Rahim, my dear vascular colleague. Always, whenever I go to any vascular meeting, I always look for vascular surgeon who were unable to attend, and I will try to summarize what are the recent changes, what are the recent trend as much as possible. At the moment, I am attending PAIRS meeting 2025, Pan-Arab Intervention Radiology Society, held in Dubai from 9th until 12th of April. Really, there are so many things nice about this meeting, and I will try to go through them with you. I have attended today, which is the first day, which start from 8 o'clock. Usually, this is a good time to start rather than starting late. So, from 8 o'clock, there are basically three, let us say, three big holes: hole A, B, and hole C. So, in the previous meeting, usually you go between multiple holes, but here they have put, let us say, hole A, which was mainly for vascular surgeon, arterial cases, aneurysm and peripheral vascular disease, and new trial. The hole B, as you can see, liver transplantation, GIT intervention, and venous, and the hole C for the neurotract. So this year you can easily say I will attend this whole A, probably the whole day, and this is a great advantage of this congress. The other big advantage, which was really fascinating, the amount of workshops. As you can see, workshops start from 9 o'clock to 10:30. Um, from 9 o'clock to 10:30, starting of workshops. The amount of workshops was fantastic. I would say yesterday there was something like probably 30 workshops, multiple rooms. There was around 8 rooms for workshops. Each company will take the workshop, and the workshop is being repeated, it's not giving once. So, for example, lithotripsy. So they put it on first day, second day, and on the third day, and they put it in multiple time as well. So there is always a chance for you to see the device, manipulate the device, and all companies have brought their simulator to get a hands-on experience. And we always was saying that beside the lecture, a lot of junior and middle grade staff and even senior staff would like to attend the workshops, would like to see the clinical impact of the technology. And workshops were really plenty, beautiful, and have a lot of benefits. So, for example, the first workshop was about transarterial chemoembolization. A lot of chemoembolization for the liver is being done by radiologists, which is very common technique. And transmesenteric access for bleeding cases, and prostatic embolization. And luckily, we have two very eminent speakers in this regard, Professor Muhammad Shakir and Professor Karim Abdel Tawab. So you can see a lot of cases and lecture in the glass hall room, and also we'll go to oncology and neurology. So workshops, as you can see, like a continuous event, and very important for you to attend. If we go back to the lectures was, as I said, started from 8 o'clock, very early in the morning, and um, it was fantastic. The whole A. So, whole A, usually the moderator is Professor Ayman al-Sibai, a very famous intervention radiologist, and Professor Suleiman. And it was really very nice. There is multiple talks, as you can see, open surgery and physician modified arterial grafting and laser fenestration, again by Professor Hicham Kouber from France. There was also very nice lecture by Eric Verhoeven. Eric Verhoeven about the stent technology and how they develop bridging stent, which you can do the funneling shape just with a balloon, especially funneled balloon. It's a new device become really standard of practice by Eric Verhoeven. Professor Jenkins, Michael Jenkins from UK, speak about how to retrieve devices retrieval and the conversion for a failed EVAR. And he has a huge experience in trauma cases of UK. And he did show a video of a removal of EVAR devices, failed EVAR devices. And there are so many tips and tricks in these difficult cases that all junior staff should really attend. There was also a lecture about artificial intelligence in AAA and very open panel discussion. The discussion was done really not in just raise your hand. No, there is a QR code on the hall that you send your question to which of the speaker, and the moderator will have a tablet to say. So this is the, let us say, the modern standard way of putting question. It's open for everyone. You don't need a microphone. You put your question and you get your answers. Now you can see Hall B about hepatocellular carcinoma intervention, and Hall C about neurointervention. And usually in Hall A, we remained in the whole day. There was a CLTI summit, and it seems that uh, a lot of devices is coming for chronic critical limb ischemia, and a lot of technology become, for example, the atherectomy devices become now like a standard practice. Drug-eluting balloon is standard practice, and a lot of new stents coming. Professor Fakhr Al-Masri about stent and BK total occlusion, and very famous intervention radiologist from United States. Below the ankle recanalization toolbox by Vandenberg from Switzerland. It was fantastic because now even you can do below ankle recanalization technique, but you must have special tools. They spoke about scaffolding, again by Professor von Werbeck from Germany. Professor von Werbeck, one of the main uh, intervention radiologist in Germany. I have learned from him a lot from atherectomy devices in the era of silver hook and turbo hook. Really, I have multiple courses with him, and he was speaking about scaffolding. And it seems there are new coming stent which are biodegradable. We thought that biodegradable era is gone. It seems it's been revived, and there are new biodegradable stent. Fantastic lecture from my dearest Professor Samer Qusayr. Again, fantastic. Speak about recanalization and how data affect our decision making. And Professor Mohammed Hamadi also spoke about EVAR cases and fenestrated cases, and 6 and 8 fenestrated cases, which are becoming quite routine practice. Then there was an opening ceremony, again was fantastic. And then there is a lunch symposium, again by a novel bioabsorbable scaffold. So you can see the future, the bioabsorbable seem to be coming back. Obviously, this meeting, there was attendance, which is quite large, quite huge. I'm not sure the number. I don't want to say wrong number, but it is at least 30% more than previous year. It's a big hall, hole A, B, and C. The sound system was fantastic, so you didn't hear other holes. And they have collected, let us say, all speciality in separate hole. The beauty is the workshops. As you can see, workshops for peripheral arterial intervention, workshops for neurology, workshops for venous, for atherectomy devices. Workshops is a continuous circle. In a nice glass room, you speak directly with one of the proctor, and this we were asking for quite a lot. That the most important thing when you attend the congress is workshops. So as if you are doing cases. So, for example, I've seen a lot of junior staff, junior vascular surgeon and junior intervention radiologists have done something like 30 procedure in one day on a simulator, and they learn a lot of tips, a lot of tricks. He asked a lot of questions. Now the intervention have expanded quite a lot other than neuro intervention to standard practice is musculoskeletal intervention. And there is also bone intervention, vertebroplasty, and also ejection of joints in case of pain, and even embolization of the knee in case of pain. So you always, not just you see your own specialty, but you see the spill over other specialty. And you see a lot of friends. You see how they work, how they perform. The colleague working in Germany, in United Kingdom, in France, in United States, how things are evolving. So it gives you, let us say, a light on the international vascular arena. And you will see all companies having new devices. They are there for you to try them. Again, glue embolization and tips and tricks for tumor ablation with radio frequency and other technique. So here, usually you plan your day for tomorrow to see which workshop you like to attend, where it is, what time it is given, where it is given, and who will be giving it. So here is kidney stones and leak IR management. So the PAIRS 2025 is one of the best in the region, no question about it. Huge advantage. All industry company are supporting it. It's a wide place. The internet is fantastic. Usually, when you have a big number like 4,000 or 5,000 doctor in one place, usually you get a problem with the internet, but you don't feel anything at all. I'm sure they have supported with at least 10 high-speed DSL internet. So internet is fantastic. The atmosphere is fine. The food and drinks, they kept it away. So when you are in the meeting, you're really concentrated on attending, asking, seeing friends, learning. It's fantastic. And I think one day in Paris Congress save you something like 6 months while you are attending here, reading there, and seeing there. You also see the most recent IVUS machines, the most recent duplex scanner, and how the artificial intelligence affecting the whole field. So I'm planning for next day, tomorrow, to attend the full day. Again, I will try to summarize it, what I have learned from the lecture that I have attended, and what workshops I have learned that I have attended and learned from it. And my job is really to transfer everything that is new in that meeting as much as possible, as much as it is humanly possible for you. So you will have a feeling, well, PERS 2025, yeah, I have a bit of information about it. I know what happened. It's now becoming a standard of all other congresses. I advise anyone who is putting a program that you must cover the topic in a very nice session. The title of the session say what you are speaking about. Obviously, women's health becomes an important integral part of all our meeting. How intervention work in women with a small artery has statistics are different, and usually get the heading of the session and you cover all the topics. Tomorrow we'll speak a lot about aortic dissection and how to prepare a patient aortic dissection, how to prepare the proximal landing zone and distal landing zone, so much techniques and so on. So I hope I have given you a glimpse of summary about the first day, and I hope to summarize second and third day for all of you. If you have any question about the program, please put it in the comment section. And I wish you all the best. My name is Dr. Mohammed Omar Farouk. I'm a consultant vascular surgeon from Egypt. Wish you all the best.